Hi, my name is Nicole Thomas. I'm a crisis intervention specialist for the local suicide hotline here in Richmond, Virginia. And I have received a phone call from client Marie, who is a 32-year-old married mother of two children with a son age 5 and a daughter age 3. Marie has reported that she has a history of depression and is on disability due to chronic pain. Marie has felt suicidal in the past and has spent time in a psychiatric facility. Marie also reports that she stopped seeing her counselor and also stopped taking her antidepressant medications when her insurance ran out after her husband lost his job a year ago. Marie was a full-time art teacher, and she has not worked since injuring her back. Marie and her husband John has recently moved to Buffalo last year after John lost his job with family members. Maria reports that her and her husband John have been fighting over the past 6 months, and now the fighting is no longer verbal but has become physical. And that Marie reports that her husband John has been spending a lot of his time, more and more time at the local bar, spending what little money that he's made from low-paying jobs. Marie has also called and expressed thoughts of suicide with a specific plan to carry out the suicide by overdosing. And she mentioned several times about being in extreme physical pain. She also disclosed that her husband John is soon to be getting out of jail, and that her children were recently removed from her home by Child Protective Services. So based on all of the findings that Marie shared with me, I feel that a home visit is necessary to further investigate the situation of which Marie is going through. So upon my arrival at Marie's home with the local law enforcement, I found Marie. She was inside her home crying. She presented tearful and hopeless and depressed. Marie's home was unkept and unsanitary for appropriate living conditions, and she stated feelings of inadequacy as a parent. I also noticed that the light switch, when I flicked it on, that there was no power. Marie appeared to be injured and was found holding a pill bottle. So quickly, I established a rapport with Marie to ensure feelings of comfortability. And I began to ask Marie questions just to assess the situation. And I asked client, does she have access to prescription medications? Does she still have access to prescription medications? And this question was to ensure that Marie did not have any prescription meds in the home still, in case she continues to try, in case she tries to ingest them to end her life. I also asked Marie, on a scale of 1 to 10, how suicidal does she feel? And given a number of 1 being least and 10 being the greatest gives me an indication on the thoughts and probable chance of the likelihood of her harming herself. I also asked Marie, does she have a plan to harm others? And this question is a leading question to get Marie to disclose of an intended target that she may plan to carry out harming. I also begin to ask Marie, can she verbalize the plan that she intends on to harm herself. And so Marie, she appeared to have a suicidal ideation and an intent. So after identifying the nature of the crisis, which was depression due to her inability to provide for her family and her bodily injury pain. So I educated Marie on the symptoms of depression and modeled positive coping methods for her. And I recommended Marie to clean her home and how it could benefit her mental health by having a clean environment. I challenged Marie to implement healthy coping skill methods to alleviate her symptoms of depression. And then I also supported Marie with linking her to outpatient therapy services. I implemented some life skills for Marie to utilize in her day-to-day. For Marie to be able to overcome her feelings of inadequacy. And so some programs that I recommended for Marie were, let me see. I recommended Marie to an outpatient therapy that focused on her depression and also her parenting and changes within the family. Marie would benefit from participating in therapy due to her depression and feelings of hopelessness related to her home life. I also recommended Marie to schedule an appointment with a psychiatrist that was focused on treating depressive symptoms. And Marie also can be treated through the psychiatrist for possible substance abuse as well, and may be assisted with stabilizing housing as a result of her job loss. We reached out to Child Protective Services to further assess the condition of a home and monitor the well-being of the children in the home. And due to the physical condition of Marie's home, a crisis worker would be alarmed and not that the environment is not suitable for a child, but to ensure that Marie kept a very clean environment for her children. I explained to Marie that it is recommended to have CPS to remove the children for a while she works on herself until she is fit enough to maintain her home in a sanitary and update standards and be able to maintain her feelings and emotions as well. I also we established Marie to attend a workforce center or career pathways to assist Marie with finding a job and stabilized housing. And so Marie, she appeared to be stressed due to her losing her job and not being able to care properly for her family. So the Richmond Workforce Center or local Goodwill would be an excellent starter place for Marie to look for employment opportunities, as Goodwill matches individuals based on their capabilities and their skills. So these were my findings in assessing the home of the client and ensuring that she was no longer presented a danger to herself or the community, and to ensure that her children would be in a safe environment. Thank you.